সবাইকে প্রীতি ও শুভেচ্ছা জানিয়ে আমি ডাক্তার রুবেল সাজিদ আপনাদের সামনে হাজির হয়েছি। আজকে আবারও কিছুটা কথা বলবো আপনাদের সাথে রিল্যাক্স রেডিওতে। আমাদের মেইন যে জিনিসটা ছিল যে করোনা ভাইরাস নিয়ে আসলে অনেকগুলো প্রশ্ন করার কথা ছিল। তো যদিও বা আজকে আমার শোটা হবে ইংরেজিতে, আমি খুব দুঃখিত, যেহেতু আমি বাংলায় শুরু করে দিয়েছি অনুষ্ঠানটা। আমি শুরুটা নিতে তো এনিবডি, হাই এভরিবডি, আই এম ডাক্তার রুবেল সাজিদ হিয়ার ইন রিল্যাক্স রেডিও and I'm doing my show from home, you understand, because there's no background. And so uh, we had a discussion yesterday with our colleagues and friends. They everybody wanted to know, that is, if the coronavirus, the current situation in UK and all over the world, is how it's going on. And so you can call us on number you can see on the display, but the problem is you can call me on the other mobile number also, 0785 07960778275, 07960778275. And the other thing is, I will try to give you some information about the coronavirus current situation, because in all there are some countries in the world, nearly most of the important countries, they already had said, that is, no flight can uh, come to the from UK, especially from the UK. They will not allow any flight from UK due to the new coronavirus. The new coronavirus. It is systematically, they are saying that last year, yesterday, I was studying about that coronavirus and the characteristics. So what I found, that is, that this new type of coronavirus is bit uh, characteristics are not the similar as the normal coronavirus we had when the government, UK government, trying to help people with the vaccine and the vaccination. They started already, and it will be. They are trying to distribute this vaccine to all, but they try to do first with the health workers and those who are living in the older home, more aged, 75 plus, and after that they try to introduce with the those who are 65 plus, then 55 plus, then 50 plus, on this way. But the main problem was, that is, when they are trying to make everything okay. They thought that, okay, the vaccine has come, so everything will be okay. But they found the new patients, those who were coming to the hospital with the new patients for coronavirus. They do not have the same similarity. I mean, they do not have the same type of coronavirus infection. The virus characteristics is not the same as coronavirus we started, or the what you can say, the doctors started, physicians started, and they found previously. So, and this virus is, they're saying, according to the BBC, they're saying it is uh, very high. It is very high. So far, you can see, I can see here in the distribution chart, that is in the 20th December. 20th December, it was 19th December, the infection was 27,052, and then 20th December, it was nearly 35,928. It's nearly 36,000. And yesterday, if we can say, it was 33,000 something. So the main thing is that the government is trying to help people, trying to say to people, do not mix with the other families, do not go outside if you do not need to. The same thing as we can see in the in the March month, we had the first lockdown here in the UK, and what the government tried to do at the everybody is, you should stay at home, you do not need to go out uh, if you are not a worker, health worker, or if it is not needed. This is not that you're going out for your just to see your friends or having fun or something, but uh, the two household, because government do not know the why and how this is spreading. For the Christmas, it's a many the people are out. They thought first time that okay, vaccine had come, so now we can go out and so. But for the Christmas, when the market is open and people are there, they they found that the market is open as well as the people are out, but they are not maintaining the regulation that government had said. Number one, I can say the social distance. If you go to a market, and if you want to go to buy something from a shop or departmental store, so you're not obeying the rule. You're not maintaining that the social distance that is said 1 to 2 meters. There, it is written there. Please maintain the distance 2 meters, but you do not do that. Number two, face covering. Many people don't use face covering. As I can say, I have a friend, and he's the friend is my good friend. So we used to go out. We used to. We are not like that we are all the time. We are together, but we are working together. But second time I saw that is she didn't have any mask with her. So I'm not saying that she don't care, but the thing is that it's very easy to forget the mask. So if you can have a mask in your pocket all the time in your jacket, because it's cold now in UK, so you can have the mask in your pocket, in your jacket pocket. So if you're going in a into a shop, or if you're going out, when you need, you can do it. You can use your mask. Number three, that is the wash your hands. Every shop, what I what I observed last week, that is every shop has a uh, anti anti deodorant, and you can wash your hand with liquid detergent or something like that. But you are not using the spirit or anything that is. They have that spirit and everything there, antibacterial liquid is there, but we are not using that. For myself, I didn't use it when I go in, but actually according to the safetiness, if you can think so, it's it is essential for you to take this liquid, wash your hand, and go into the shop. And when you're coming out, use your hand again, wash your hand again. So it's this, but people do not people do not care. They didn't care in that time. Now, the last yesterday, what I saw it, I was out, and I saw there huge people again gathering outside in Tesco and Asda. They already have said that is everybody is everything is the supply is not didn't come, so the shortage of food, a shortage of beverage is great, and so because only for that the people, okay, we are in a lockdown in the same as March, so we should have to buy, so they bought a lot. Although government is saying do not panic, do not worry, uh, you can have everything, but for now, in for now, we need to control these things. Government had said that you cannot go to the market or somewhere if you do not need. You cannot mix with the other family if it is not you are not in the same family members. You cannot go out for just for chill or just for to talk with your friend or so. I can see here, if I can, I was just found here in the news sky that say that 35 minutes ago they have a news here. COVID News Live, latest updates, shocking numbers of fines issued to pub years as travel chaos caused increase in private flight bookings. Okay, what's this? I have to check that the key points. What England faces potential lockdown, new lockdown, as it was revealed. Therefore, restrictions could be extended across the country. Details of a plan of reopen the border with France could be revealed as early as today, Sky has learned. Wales drafts in soldiers to help drive ambulances as service deals with extreme pressure. Government will take stronger measures if bouncy virus countries to spread, says Home Secretary. Uh, Stormont said to advise against travel between Northern Ireland and the rest of the UK. Anyone arriving in Greater Manchester or the West Midlands from Tier 4 areas and Wales told to self isolate for 10 days. We're looking for stories of how people are making the most of Christmas this year. If you'd like to tell your story, you can WhatsApp. Okay, the same thing here in the Relax Radio also as Sky. Because if you have anything you want to say for Christmas, because many of you try to go to your home country or to the downtown or you want to go to your family for Christmas, but the government is not allowing it. Government is saying, please, please, please stay home. Do not go out because this could be a problem for you, for your family, for your neighbor, for your parents, for your children, because you do not know that you are moving if you are secondarily carrying the virus or not. Uh, and so whenever you are stuck here, where they are saying, if you are in London, do not move for Christmas. If you have packed your everything to go to your home or to somewhere else, please pack it. Stay home and enjoy your Christmas at home now this year because of the problem for the coronavirus. Anyway, I can just give you a little bit chart here for the coronavirus cases as seen from it was from yesterday actually. The whole the coronavirus cases total is 77,822 252 77 million, and the death is nearly 1.7 million, recovered 54 million. Active cases in the world now, it is 21 million, and you can, as I can see here, the main important part was here, that is for the UK. Daily summary for the UK, they say that is the positive cases. Uh, Positive cases, as I told you, the cases they found 33,364, and last 7 days it was more than 54.8%, 55% increased for in last 7 days. 203, 204 nearly last patient found in UK, those who were uh, infected for the coronavirus. And other thing is that we can say here, the death within 28 days, the positivity daily is 215. Total in 7 days, that is 3,215. It means 231% increased. So it's panic. It's not that good. 231% increased death rate for UK in for coronavirus. So this is not a good news. Patients admitted in the hospitals or wherever else in the healthcare centers, that is nearly daily 2034, and last 7 days it is 12,745. It means that 18% it increased already. That's why government is trying to give information to all. That is, if you think that is you have a problem with coronavirus, or if you have cold, if you have fever, stay home. Do not go outside. And the restriction the restriction in England, as well as in all the world, it is the restriction is they're nearly the same. They are saying that most of the time they're saying the same thing. If you have if you have fever, if you have cold, if you have cough, so please stay home and isolate yourself. The restrictions are similar to the last national lockdown in England, and in November they include the residents should stay at home unless uh, they need to go out or something like this. But hairdressers, nail bars, indoor entertainment venues, everything everything's closed. And the other thing we can find here, that uh, here in the BBC News, there is a that is the COVID. What are the new tier and lockdown rules in England? It's called Wales and Northern Ireland. They have something they have written here. They said more areas could see restrictions tightened to control a new variant of COVID-19, the UK Chief Scientist Advisor Sir Patrick Vallance has said. A, a tougher fourth of coronavirus restrictions for London and much of southeast England is now in place. The whole of Wales has entered another lockdown. Mainland Scotland and Northern Ireland start new lockdowns on Boxing Day. What are the rules of Christmas? The government rules of Christmas. You can find it in the BBC. I'm just reading the BBC News here. What are the rules of Christmas? People in their four uh, areas of England cannot travel elsewhere and are only allowed to celebrate Christmas with members of their own household and support bubbles. Okay, and then the elsewhere in England and in Scotland and Wales, joining other households in Christmas bubbles is now allowed on Christmas Day only. In Northern Ireland, and day between 23rd to 27th of December is allowed. E- Exactly who can be in the temporary bubbles varies across the UK. Okay, what are the COVID rules in England? The areas of England have been placed in one of four tiers, depending on factors such as how fast COVID is spreading and pressure on hospitals. People in tier 1 to 3 should not travel into the new tier 4 areas. Okay, and across all tiers, people should now stay local. And what is tier 4? What are the new restrictions for tier 4? The restrictions are similar to the national lockdown and include residents should stay at home unless they have a reasonable excuse, such as work or education. All non-essential shops must close. Hairdresser and nail bars must be closed. Indoor entertainment venue must close. Gyms and indoor swimming pools, indoor sports courts, and dance studios must close. You cannot meet other people indoors unless you live with them or they are part of your separate bubble. People should not leave their four areas to travel abroad, except for limited response, including work and education. Weddings, weddings and civil partnership ceremonies are only allowed in exceptional circumstances. Okay. So what can you do in tier 4? That is also had questions. So they have written here. So like this, activities still allowed includes meeting one other person from another household in an open public place if you are both alone. Then the shopping of essentials such as food and medicine, outdoor pools, playgrounds, sports courses, golf courses, and horse riding centers can open. You can leave home to work, education, training, childcare, and for medical appointments and emergencies. Communal religious worship, support bubbles are still allowed, and children can move between separate parents. Okay, so the tier 3, now when there was a tier 3 and the very high, they have separated all the way. They separated the um, households and separated everything with from the meantime they separated the tried to separate the people from all the tiers, for the third to fourth, second to third. So when you are, if you want to go out or something, so you do not know why these restrictions. This restrictions only for that is you do not know if you're a carrier. So if you go out and if you are mixing with the new people, probably you are taking the virus from them, or probably you are spreading the virus from yourself to them. In the cases of COVID-19, they have found plenty of cases that the subject is not always the subject is infected himself, or but they could be a carrier somehow. So they scientists are trying to find out how it is spreading so fast, and they are trying to find out the type, the mutation that is they have found that the most of the cases, 70% cases, they have said, I read somewhere that is a 70% cases they have found the new coronavirus cases. I mean, the patients, they do not have the same similarity to the coronavirus as before. So in that case, the government has this lockdown system, and so we should always think about not this way. It do not mean that I'm free. I'm not sick. I'm not positive in coronavirus, so I can do whatever else. No, you can check yourself. If you can stay home, if you can say, you do not know either if you're a carrier. I'm trying to say all the time that you do not know that all the time that you are carrier or not. There is some question one of my friend asked me, that is what he is getting what is it, depressed when he is staying home, and so. But well, what should I do now? So that you can, if those who are thinking that, oh, I'm going, well, I'm depressed, so yeah, but you go out. I'm not saying, and government is not saying that you cannot go out. They're saying that you can go out, but alone. Go out alone, walk a little bit, have some exercise, freehand exercise, and just go if you can see that there's people gathering, please do not do that. I used to do like this. I used to go to the Tesco in the night time when I need milk or something. I buy and come back, and I used to walk in that time from 10 o'clock to 10:30, half 30 minutes probably, or 9 to 9:30. It depends that when I'm free. So I go out and walk a bit. Yes, it's not that when you're. This is not good that you are always staying home. When people are staying home and sitting and watching movie and listening to song and doing nothing, so it's not good for only not for the one way, that is they are getting depressed. It is not only for the depression. This is for that is the people can the last after last lockdown, we could we could find that is that there are many many people came with they have developed pre-diabetes, that is the borderline diabetes. They have the blood sugar level is quite high, well, or not quite high, a little bit high, I can say it, from 5.5 to 6.9. This is the borderline we used to say, So they have the more than six or something. So in that time, what they should do, they cannot have the medication due to this is the borderline. If it is more than seven, so people can have the doctors can introduce a medicine to them. But before that, we can say that is the control yourself. When people are staying home, they used to they are little bit depressed, and when people are depressed, they eat more. They do not have that much movement as usual. So what I think that is, it is better for you to go out every day, go out 2 3 times, go out and just try to find out in the road and the place that you are you not that much crowded, I can say. So you just go out and walk a bit, try to run, try to jogging yourself, just something so you can have your little bit motion. When you have a good motion, so you can burn your extra fat, you can burn your extra calories that you have taken with the food. So in that way, you can improve yourself. In that way, you can protect yourself from the other complication that are coming for staying home or so. uh, so the friends, you are watching this program from Relax TV, radio and TV, live in the Facebook and YouTube. I'm Dr. Rubel Sajid here. You can see as I'm home and I'm trying to do my show from home because 12 to 13, 12 p.m. to 1 p.m. I have the show in Relax Radio, but I couldn't go to the studio because actually I was thinking that is if I do I need to go or not. But when I asked my MD that is if I can do my show from home. So she agreed. She told me, yeah, you can do it home because you have the slot from 12 to 1. But if you every week you used to do this program, so it's better that you can do a show from home. So I'm here from home. So I'm not actually a little bit happy that I couldn't make myself comfortable for doing the show. But the first day, next day, I'll try to make it more beautiful for you. Uh, Anyway, friends, our CEO Amin Raja should be here anytime. I don't know because he told me that he will join me. He will join me. So I don't know when he's joining with me. You can call me on the telephone number if you want to join me or if you want to talk to me. So my phone number here is 07 07960778275, 07960778275. So you can call me and you can talk to me if you want. Now I'm trying to uh, find out. Yeah, there are some questions that is previously I had some question here that one patient called me and said that is, doctor, can I refuse to take the vaccine? So yes, the answer was yes. You can refuse always. You can always refuse. Nobody is giving you pressure to take the vaccine. But the problem will create in that time if you are sick yourself. If scientist, government, or NHS or health worker, they think that is the you are somehow carrying, or you had a what they said, you had a group that has the coronavirus positive symptoms. In that time, it can be a pressure to you to take the vaccine, because of the not for safety of you, it is for the safety for the others. So you always can deny to take the vaccine, but for improve yourself, to improve your body immunity, it is needed that you should take the vaccine. Although many of those who are writing here and there in the internet, they say, "Ah, is the new coronavirus virus will affect for with the old vaccine or with the old vaccine?" The thing is, scientists didn't say that it will not work, but they said the characteristics have changed. So if you can, when it is changed, so people should think about their it will take some time to it will to for the scientists to find out that if it is the same working, or they have to do something more. So now we have the two situations, that is the COVID-19, the first phase that we had, that was first phase that we had, that was okay. But first phase was was okay, but the next phase now, the new type of coronavirus, it can be a little bit harmful for you, number one. So you can take the vaccine. So for I understand, that is, you can take the vaccine for protect yourself, but if there is some problem next, so they can find out, that is what they could they should do more. uh, Other thing was, that is the uh, many of them, there are some people, those who are against the vaccine. So my question is, why you are against the vaccine? Because you are not infected, or what? If think, that is, I am against the vaccine and I got myself coronavirus, COVID, I am COVID positive. So then what should I think? I should think about, oh, yeah, I got COVID-19, so I have to recover myself some way anyway. So then I'm thinking, okay, I need to take the vaccine. So when the situation comes to you, when you're sick yourself, then your opinion is changing. Then your opinion is changing. So that's why the main thing is, the vaccine is good. That's why the government, the health workers, the researchers, everybody, when they found the vaccine is helping, then they decided to give the vaccine to the mass people. Otherwise, it will be for them only, that is, they are affected. So there's nothing to say no for the vaccine. Those, but that is the main thing is, you can always deny. No problem to deny it. But if you, if the government thinks, if the health worker thinks, if NHS thinks, that is, you can be a problem for spreading the disease, to stop the disease spreading, to protect others, then they can ask you to take it they ask you to take it. Otherwise, that is not necessarily that you can deny all the time. You can deny to not to take coronavirus vaccine. That's all for today, friends. I am here. I have the show till 1 p.m. So I have only 5 minutes, 3 minutes to end this show. So I was discussing about today. I was discussing the summary is that I was discussing about the coronavirus now the day situation. But as I told you, that is coronavirus first phase was, and the second, now this phase is not similar. And all over the world, the world, they not allowing any flights from UK, not in Germany, not in Sweden, not in USA, not in the Asian countries and many others. They are not, because the new type of coronavirus is not the similar as the old one, the old phase one. So that vaccine had came. So yeah, and it is spreading very fast. And last couple of days, this all the patient, those who are infected, scientists found that they are not the same type of coronavirus. So still, the researchers are researching, and they are trying to find out how they can help with this vaccine, or how they can help with the medicine to the patients, and so stay home. The main thing is stay home, use your mask, wash your hands. So these three things can help you to protect yourself from this coronavirus. It's Christmas is coming, so Merry Christmas to all. But please, please, please try to stay home and do your Christmas this year because of the pandemic. Do your Christmas in um, a small way with your friends, with your, not your friends, with the family that you are living with. So that's all for today. Merry Christmas and Happy New Year. Probably I can see you before the New Year. But anyway, Merry Christmas and Happy New Year to you all. See you next week. Thank you so much.